Hi, I'm Dr. Rex. I'm an orthopedic surgery resident who plans to pursue his board certification in obesity medicine and whose goal is to help you maximize and preserve your mobility. And this is how I think about diet. The first thing to differentiate when talking to patients about diet is if the overarching goal is currently weight loss or sustaining the current weight, or is it gaining weight? All of these three different things can drastically impact what type of diet that might be most effective for a patient in their current phase of life. Categorically, I think most Americans would benefit from some degree of weight loss. That being said, many people are at their goal, have different priorities, have goals related to gaining weight, or for me as an orthopedic surgeon, I think about perhaps an upcoming surgery or recovering from a surgery where weight loss might not be appropriate, and even some evidence would suggest that there actually may be increased risk to patients if they are losing weight immediately before a surgery. So weight loss is not always the answer, and it's important to understand the context of is someone trying to gain weight, maintain weight, or lose weight? And so if you're watching a video about diet, I assume there's a greater chance that you might be someone interested in losing weight. And so as a doctor, the way I think about diets for weight loss is I put them in one of three buckets. There are diets that focus on calorie restriction, there are diets that focus on meal replacement, and there are diets that are a ketogenic diet. And really all diets can fit into one of these three buckets. I think there's a lot of diets out there, fad diets, that really just try to restrict food groups that you're eating that net result in a decrease in the amount of calories you take, that calories in, calories out is not the only thing, but it is an important factor to consider. And so the vast majority of diets fall into a bucket where some way the goal is to get you to restrict the amount of calories that you're taking in. That may be through directly tracking calories, or that could be something more gimmicky like only eat foods that are green or only chew your food greater than 50 times before you swallow. The goal of that is just to get you to eat less food. The next category I would say of diet is meal replacement diets. These are typically short-term diets where you are replacing meals with shakes, bars, and soups, and ultimately the goal of that is to very significantly decrease your caloric intake. But I think that's really trying to sort of shift a mindset, and that's different than a low-calorie diet, where a low-calorie diet may be intentional as something that is a lifelong lifestyle diet, while meal replacement diets are typically only appropriate for the short term. Final calorie is ketogenic diets, which ultimately there is some aspect of trying to get you to eat less by changing your hunger, but this is a diet that mechanistically fundamentally changes the way your body metabolizes food and where it's getting its energy sources. This is something that I think is very safe and effective based on an abundance of research, either as a more short-term thing or a long-term lifestyle thing, that there are plenty of people that have lived decades on a ketogenic diet with great health outcomes. So in general, when I think about weight loss diets, three categories: calorie restriction, meal replacement, or ketogenic diet. The next thing I think about, I've sort of touched on, is this trying to be a short-term diet or a lifestyle changing diet? I think that in general, many people think about diet as this is a short-term thing I'm going to do to meet a goal. I want to fit into this certain clothing or look a certain way by X date, and it's a short-term change. I think there is value in doing short-term diets, but ultimately the most important thing is going to be something that is sustainable for a lifetime. And so you can do short-term diets to sort of kickstart weight loss and then change to a lifestyle diet that you're planning to continue for the rest of your life. But you have to understand that the challenges of the short-term diet aren't going to be something that perfectly correlate with a long-term diet plan. And if you go back to eating the way you did before you had any dietary intervention, you're going to have sort of an inevitable return to your baseline weight if weight loss was your goal, or you are not going to maintain your weight gain if weight gain was your goal. That even if your goal is a short-term diet and you have a short-term goal, you need to be thinking about what is the long-term lifestyle changes I can make through my diet. The next thing I think about is sustainability, both in a short-term or a long-term. That I live in the real world and talking to hundreds of people, if not thousands of people, about their diet and their goals, the most important diet that someone does is the diet that they actually do and stick to, and how that fits into their life. And so this can be thinking about, how does cooking and preparing meals look for me? That am I going to need to cook all my meals with this diet because it's very specific? Or can I have a meal service? Am I ever going to eat out? Along those lines is cost. That cost is a big factor in what diet might be best for someone, that you can't participate in a diet if you can't afford the diet, or you may not be able to sacrifice other things in your life to be able to afford a diet. And so that is always going to be a consideration for a lot of people. Something I also think about is sort of more of when the real world happens. And so thinking about when you get invited out to dinner with friends or go on a date or the holidays come around, how does this diet, whether it's short-term or long-term, integrate into those things, those life events that are coming up? And I think that's something I always try to talk through with my patients, to sort of think about those challenges before they come, and that can really help with the sustainability of a diet. Only after all of those things do I start thinking about something like macronutrients. As an orthopedic surgeon, who a lot of my thought about diet is around optimizing before surgery and recovering from surgery, protein is the most important macronutrient I think about, that I always want to make sure with my patients, and I would recommend to anyone, regardless of your goals, to be maintaining your protein intake. I think that there are a lot of camps out there of saying carbs are evil, fat is evil. I have never met someone who is in the protein is evil category. And so I think protein is something that really needs to be prioritized and come first. And whenever you're thinking about a diet, sort of your next thing is, okay, how am I maintaining adequate protein intake within this diet? Then the last thing I think about is micronutrients. And these are much more diet specific. For example, if someone is doing a entirely plant-based or vegan diet, I might think about ensuring that they have adequate intake of iron, particularly the fact that plant-based sources of iron are much, much less bioavailable than more animal-based sources of iron. And so I think about, how are we potentially meeting any micronutrient shortcomings of this diet? On the opposite end, if someone's doing a carnivore diet, I might think about making sure that they are having adequate vitamin C intake, which is much less abundant in animal sources. And so that's something that is more of an afterthought of how might someone need to fill in the gaps, or how does a patient need to fill in the gaps potentially through supplementation to make sure they're meeting all of their micronutrient needs in this larger context of living this diet and using that diet to meet all of their other goals. There are two final things that I think about with diet in general when I'm talking about with the patient. The first is that, broadly speaking, the research does support that diet is significantly more important than exercise if your goal is weight loss. And so diet is something I really do want to prioritize as something that may be making a bigger impact on your life if your goal is weight loss, is your diet, than exercise. That being said, I think for overall health, exercise is equally important, if not more important, especially if we're talking about maintaining, maximizing, and preserving our mobility as we age. Exercise cannot be understated. But in sort of weighing the scales of diet versus exercise for weight loss, I think diet is more important. And that's particularly relevant for me, that I talk to patients all the time who have a significant orthopedic condition limiting their mobility, and they're also trying to lose weight, that I try to encourage them that, yes, exercise might not be something you can do at this stage of your life as you are recovering or seeking treatment for an orthopedic condition, but that shouldn't be something that you should take as being a massive barrier to the goals that you may have related to weight loss, because ultimately the diet is going to be more important. Now, all that being said, I also take diet with a little bit of a grain of salt, and I realize that when you go into these large research studies and look at the effectiveness of diet in inducing weight loss, is that it's not that effective. When you do a randomized controlled trial and ask people to follow a diet, it's really, really hard. And so I think that's where the most important thing is sort of fitting that into the context and trying to really adapt a lifestyle. That people will say, oh, dietary interventions don't work, because as soon as people stop doing them, they regain all the weight. And that, broadly speaking, is true, but I think there are dietary interventions that if you really buy into and look at as a lifestyle switch, that it can be very effective. That I have met patients who have had purely dietary intervention based weight loss of 100, 150, 200 pounds, and something that they've kept off for 5, 10 years by following a lifestyle switch in their diet, and that they approached it not as a short-term diet, but as a lifestyle. And so I understand that there are shortcomings of diet, particularly when we are now comparing to GLP-1 agonists and looking at bariatric surgery, that in the studies, diet is not going to ever be as effective as those medical interventions. But on an individual basis, if that's something you really buy into and you're determined to change your life for the better, and you're doing it in a way where you are fully empowering yourself, I think that's one of the most powerful thing I can see people do, is when they are the ones leading the charge, taking ownership of their life, of their health, of their mobility, and they are making the changes that lead to these sustained lifelong benefits with no adverse effects. And it has just repercussions throughout all aspects of their life in a positive way and in all aspects of their health. And so I do think diet is really important and something that I do like talking about with patients. And so if you want to hear more of my thoughts about diet or have specific questions about diets, I'm thinking about doing a tier list ranking of sort of my just gut reaction to different diets and what I think about them from a medical perspective. So if you have any of those questions or want to see that video, make sure you subscribe and leave a comment down below to let me know. If you have any other questions or any other video ideas, please let me know down below. I'll try to read every single comment. And as always, don't be ordinary, go be great.